Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Kim Downey, Ziya Altug, Shirish Sachdeva. They're all physical therapists and physician advocates. Today's Kevin MD article is How Physicians Can Reclaim Resilience Through Better Sleep, Nutrition, and Exercise. Everybody, welcome to the show.
Thanks,
Thank you,
Kevin.
Kevin.
Thank you.
Thank you.
for having us.
All right, Kim has been on many, many times, brings together always an eclectic group of physician advocates. So, Kim, how did you bring everyone together today?
So Zia connected with me on LinkedIn a while back, and then reached out to me after I commented on one of Dr. Jonathan Fisher's posts, and we started communicating, and then we got to meet in person at Jonathan's book launch party a little over a year ago, and that was fantastic. So then they were connected, and we just started communicating and supporting each other's posts. And my thought for this article was that I wanted to spotlight more healthcare professionals that doctors can have in their back pocket professionally and personally. And I've had a registered dietitian on my YouTube channel, and she's been on, with you to highlight how they can help doctors by helping their patients, and also how they can help the doctors themselves. And I also had on a local pulmonologist for the same reasons. And doctors know that good sleep, nutrition, and exercise is important for the health of their patients, though they frequently don't prioritize these things for themselves. And I was just trying to look up statistics, and I came up with just 25 to 30% of doctors exercise, but they would tell all of their patients, right, that exercise is important. So I wanted to collaborate with a couple of physical therapists here to emphasize the importance of these self-care approaches for the doctors themselves.
Wonderful. All right, let's talk about the article itself. Shirish, just tell us about the article and what inspired you to collaborate with Ziya.
Yeah, so Zia did reach out to me, I think in June, if I'm not wrong, of this year. And Kim and Zia had already collaborated on this idea and the thought, and they offered this concept to me, and I was happy, gracious. I was like, this is an awesome topic, because on a day-to-day basis, we deal with this issue of not getting our lifestyles in order, with so many things we're bombarded with on a day-to-day basis, with our work, with multiple different responsibilities that we have. So I was like, this is a no-brainer. We gotta help our helpers on a day-to-day basis. So I said yes, and I was looking for some stats, and as Kim was mentioning stats, and we'd seen that there was a study in Taiwan that was done on hospital group, and every different profession was examined. This was done in 2018, published in the Journal of Medicine. It was Dr. Yi and his colleagues. What they came out with was that the most strained group in the whole hospital community when they were examining for metabolic syndrome were the physicians.
Mm.
The group that was the total population that was examined was some 6,700 people, and about 18.3% of them had metabolic syndrome in physicians. The overall percentage was 12. So physicians actually took the lead on just having these issues. So it's I think we can't have a healthy community if we don't have people who provide health to others, form the same sort of a consensus in between their own selves. So that was the reason primarily why I joined in this venture.
And Shirish, just for those who don't know what metabolic syndrome is, just give us a quick 30-second primer on what that is.
Right. So we're looking at a cluster of different syndromes in it. You can talk about central obesity. You can look at high blood pressure. You're having a concept on high cholesterols, primarily triglycerides, and a low HDL, which is high density lipoprotein. So you have those together built in. It sometimes tends to lead to other issues like diabetes. We call it syndrome X, which is also built in with metabolic syndrome. So these multiple syndromes can develop in one single person with gradual year to year, decade to decade insult to the body over time, adding up multiple issues. So that's primarily where this stems from.
So Ziya, just that study that was just cited where physicians are taking the lead in metabolic syndrome, that's not something that anyone really wants to lead on. What are some of the reasons that you think is behind that?
Well, the study that I'm familiar with that I've kind of prepared for is the 2025 study that was in the American Surgeon, and they were talking about self-care, about how diet and nutrition and exercise and other self-care aspects were beneficial for physicians. But I think if it's beneficial for physicians, it can also be beneficial for nurses,
Hmm.
other therapists, and the whole healthcare community.
And Zia, so specific to the healthcare professionals that we're talking about, what are some simple ways that we can improve those numbers? As you know, those of us in healthcare work very long shifts, very busy, very little time to take care of ourselves. What are some simple strategies that you implement whenever you talk to healthcare professionals?
I think the simple strategies include creating a toolbox for each person. So my toolbox may be different than Kim's toolbox, and Kim's toolbox may be different than yours. So putting in that toolbox things that resonate with that person. One person may feel comfortable doing a 5-10 minute Tai Chi program. Another person may feel comfortable doing a mini yoga program. Another person might go out and walk. Other people might have hobbies to de-stress after their shift, which might include pottery, music, playing the piano, and engaging in other hobbies.
And Zia, when you talk to these healthcare professionals, how do you discern what comes naturally to them, what resonates with them? Is it just through simple conversation? Do you have a specific set of questions that you ask these healthcare professionals? How can you individualize your suggestions to them?
If I'm working with somebody in a physical therapy setting, I obviously have more time because I've done a good evaluation and have done outcome measures and so forth. However, if I'm just speaking with a group, I kind of have everybody think for themselves in terms of what is the best things that everybody knows what feels good for them. Just going out for a walk, maybe exercising, playing the piano, working in their garage on their car. People intuitively know the things that make them feel better. And it's kind of leaning on those things that give the person that comfort. And for individuals that don't know, that have never tried things like body scan meditation or 5 finger meditation or other types of meditation, maybe they need to go out and do some exploration and maybe take a yoga class, see if it resonates with them, and take a Tai Chi class, see if it resonates, or go into the woods and do a hike. So I think exploration is the key.
Kim, you've done such a wonderful job advocating for physicians, not only highlighting some of the obstacles that we face every day, but also providing solutions as well. And these aren't just solutions from other physicians, but you've brought together healthcare professionals from the allied health professions. You brought dietitians, physical therapists like we're doing now. Why is it important to include a whole spectrum, a holistic approach, so to speak, to address the issue of physician burnout?
Well, I think when doctors share things on LinkedIn, sometimes it can feel like a vacuum and they're preaching to the choir, right, or just talking to each other. So when I bring other people on, it helps doctors know that there are other people on your side and in your corner, and they can help you. And sometimes it is physicians, like the pulmonologists who will tell doctors when they should, seek sleep help themselves, right? But then to know that there's like a dietitians out there and they can help your patients because you don't have time to talk about nutrition. So send them to dietitian and everybody wins. And then same thing with physical therapists, because I've actually seen stories where surgeons ended up not being able to practice anymore. They were in so much pain that there was like a dead stop that affected them permanently because they keep pushing through. And just spotlight that you can reach out to a physical therapist too. And we tend to be smart and kind and good team players, right? And we're used to collaborating, PT, OT, speech, and to just spotlight for doctors that there's other people out there to help you help your patients and to just to help you.
So, Shirish and Zia, I'm going to ask you similar questions. Have you, in a physical therapy session, worked with a physician, and what kind of issues did they come to you with in a physical therapy session, and then how did you address it?
Mhm. I was just thinking about that as Kim was talking about the story with the surgeon. I had a gastroenterology surgeon early on in my career who had ankylosing spondylitis. And he used to have extreme pain, but he was well aware of it. And he would stand throughout the day in surgeries with the heavy lead coat on him. And that would break his back, literally, to the point where he could not practice. So early morning, before his shift, he would come in the hospital setting to our PT department. He was the first patient pretty much opening the door with us. And he would stay for an hour. We would do a full comprehensive rehab for him. And then he would go straight into the OR after that, spend his couple hours, come back into his lunchtime, spend another 15, 20 minutes with us, and then go back again after his lunch into the OR. So this kind of showed one thing. I mean, and I was early in my career. At that time, I was unaware about lifestyle medicine. I was pretty much not aware of those things. So I saw a holistic thought process. I was like, okay, a physician, a surgeon at that point, taking care of himself before he takes care of others was a good example that was being set when I was training. And this was me training in a tertiary care hospital. So that was something that I saw. And again, since then, it's been time and again we've seen physicians comes to us. I mean, there's no day that goes by that I have either nurses in my clinic or I have physicians in the clinic that come in with multiple different issues. Again, we have top charts of back pain, spinal pain, muscle pain, joint pains. All those are there, no doubts. But frankly, 80% of the people that come in our clinic, physicians included and other clinicians included, 80% of them have a diabetes diagnosis that is set up on their chart. And this is what we see from APTA's recent stats. This is too much. And I'll say that my clinic is seeing, okay, I personally myself, in a week, I see about 115 patients in a week.
Sure.
That multiplied by 52 weeks, and you can pick 80% of those having such metabolic disorders. That's way too much. We got to do something about it. So yeah, I mean, we definitely have to collaborate on this, and there's no better way to have all team members on it.
And Sharish, what are some simple ways that clinicians can move better? What are some simple physical things that they could do? I know Zia mentioned some individualized things like Tai Chi and whatnot, but from your perspective, what are some easy things that physicians can implement?
So we've also kind of highlighted this in our article, and we've brought in some of these tidbits, small little churnable points that we bring in with an example. I'll kind of go on those, and where we're trying to save time during the day. Our 24 hours get limited. So in those 24 limited hours, 8 hours are gone sleep. This is if you're sleeping 8 hours. That is another point we make. But to add to that, 16 hours awake, there are multiple small little things anyone and everyone can do every hour. And this is daily tasks that I talk to people about. I say, move your neck every hour. Turn it left, right, up, down. Use it to stretch. It takes 3 minutes at the top to get those movements in. It's just about memorization. It's just about, repetition of those things. Stand up from your desk if you are in a sitting job. If you are doing charting, try and have standing desks. Stand up, sit down, modify yourself, be creative. Walks in between the patients can be helpful. Moving from one spot to another can be useful. Having a walk with the patient at times helps out. Sometimes in our clinic, we'd have people who have a gait therapy, and we will have them walk outside the clinic around the whole building. And that adds up well to my steps. This is the self-care I'm adding in there. So they don't know that. We're getting them into functional environment. I think physicians can do the same. We can use our socially available time frame as well as the environment to kind of bring in those small little micro breaks that we can. I know Dr. Jonathan Fisher, as Kim spoke about, I follow him and his ideology, small little things he does in his daily routine, like taking that 5 minute break in another room and just kind of doing a little small meditation for himself, calming down his breath. This type of work really helps controlling our autonomic system in the super stressful environment that we live in.
Mhm.
And again, I think I can't hardly stress anymore that physicians on top of this chain have the most stress in hospitals, in emergency departments, where you can forget taking a breath at times because you're jumping from one patient to another.
Ziya, tell us about an encounter that you had with a clinician and the problem that they came to you with, the solution that you proposed, and you really moved that needle in that individual clinician. Tell us a story.
Yeah, thank you, doctor. I do have a patient that I recall years ago that came to the clinic when I was working at a large hospital, and he was a neurosurgeon, and he came in with back pain. And again, as Rish had mentioned, the prolonged standing, using tools in front of their body for prolonged periods of time with no rest periods because the patient is under anesthesia. But he had told me just through conversations in the physical therapy that we were doing, he had told me two things that worked for him, and perhaps this will resonate with other individuals. For his hands and for his anxiety and stress, he used pottery
Mm.
because the pottery where he put his hands on there was kind of like a massage to the hands, and he was creating something, and he was in a social group. And for him, he found the pottery was very, very good. And he, in fact, he even bought a kit for his own home, but he still enjoyed going to the facility to do that with other people. And in terms of movement, he had tried many different types of things, strength training, flexibility exercises, and he was a runner, but none of those really seemed to impact his back pain. But the one thing that he did find was dancing with his wife, because dance, as he was saying, is different movements. You don't move the same way. And he said the repetitive movements just weren't working enough for him to loosen up his back. But the various dances that he and his wife were doing were excellent. I mean, he was going to a studio to do this, and that made him feel the best.
We're talking to Shirish Sachdeva, Ziya Altug, and Kim Downey. They're all physical therapists and physician advocates. Today's Kevin MD article is how physicians can reclaim resilience through better sleep, nutrition, and exercise. Now, I'm going to ask each of you just to share some take-home messages with the Kevin MD audience. Ziya, why don't you go first?
My take home message is that I think self care techniques should be taught even as early as high school and perhaps even elementary school and junior high school, different aspects of it, so that when people are getting into their professional life, it becomes second nature.
Shirish, your take-home messages.
I will piggyback on that, but I'd say start small. And self-care is the utmost important care that you can, begin with. So pick one thing that you can change and go with that change for a period of time, which is easily manageable. And you can monitor that change, take it to from A to Z, and then move to the next change. I give this example to many of our patients where so many years pass by, but if 6 months you work on one change, you could have had probably six changes in the last 3 years. So I think that starts today if you can pick. So start small, do something. It could be a 10-minute walk, it could be focusing on 8 hours of sleep, or it could be food that is not eaten from a vending machine and home cooked. So anything on those lines, whatever you feel, or as Zia said, taking a yoga class or Tai Chi or anything on those lines. But make sure you start putting focus on yourself before we engage with others.
And Kim, as always, we'll end with you. Your take-home messages to the Kevin MD audience.
Sure. So a few words that are mentioned in this article include resilience, burnout, and yoga. And some doctors cringe when they hear any of those words because for resilience, they're saying, understandably, we're some of the most resilient people on the planet, which is true. But it's kind of like throwing the baby out with the bathwater because resilience actually means going through something challenging and coming out stronger. So the principles that we highlight in this article are ways that you can shore yourself up. And the same thing with burnout. Some, doctors think that burnout makes it feel like an individual problem where it really is the system that's the problem. And if you would fix the systemic issues, they wouldn't be burnt out. And I get that, and that's true. And they prefer the term moral injury. They have different definitions, and you can have burnout and or moral injury. But again, speaking to that, while we are trying to change the system, and I think more and more people are raising their voices, there are still, again, these points that we have can help you individually. And even yoga, a lot of doctors, that's the big thing. They'll say, well, we don't need pizza parties and yoga, right? And yoga might not be for you. But literally a doctor, the first time I talked to her, in our first conversation, she said yoga saved her life. And I know men and women physicians who really do love yoga, and it might not be for you, but it's just to open your mind to try some of these things. And also, you shouldn't need permission, and you don't need permission, but if you feel like you do, we're giving you permission to put yourself first, because some doctors will think, like Dr. Michael Hirsch, right, that he was told he couldn't have a lunch break. It would throw off the schedule as a gastroenterologist. But when he decided I need my lunch, right, and by him speaking up for himself, then other doctors reached out too. But it was almost like they needed permission to ask for basic things. And these things should be priority: sleep, nutrition, exercise. So exercise your own sense of personal agency, and we need doctors to be healthy for us and for themselves.
Yes.
All right, everyone. Thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Kevin.
Thanks for having us, Kevin.
Thank
Thank you for having me.